Good afternoon, everyone. Dr. Kirsten West here. Thank you for joining me on this beautiful afternoon. We're going to spend just a few minutes going over headaches. That's why everybody's here, right? I want to start by just mentioning a couple of things that we have going on at this space. So the first thing is that we actually have a couple mindfulness classes coming up, led by Emily Horn. Those classes start September 9th, so feel free to check those out. And if you have any questions, let us know. The second thing is we're going to be doing a holistic health series for September. So stay tuned for that topic and date announcement as well. To start out, I want to tell you a little bit about why I wanted to do this headaches webinar. I had a patient come in a couple weeks ago, and they were kind of tired of taking ibuprofen and going that route, and they really needed some relief right away. So that patient came to me, and we took a look, and everything happened honestly because she ate something that she was sensitive to. She didn't know about that. So once we took a look at her neck, we found the top part of her neck had a lot of tension in that area. We adjusted her, figured out what type of food she was sensitive to, and she hasn't had a headache since. So it kind of brought me to, hey, why don't I share this with everybody? So a couple common types of headaches. First one is a migraine. A lot of people are familiar with migraine headaches, unfortunately. They can be very severe. A lot of people actually call out of work. I saw a statistic the other day that 1 in 7 people actually call out of work at least once in their lifetime due to some sort of migraine headache. Migraines typically are on one side of the face. They usually start with like an aura or nausea, vomiting, to kind of let you know that a headache or a migraine is about to come on. The second most common is actually a tension headache. And a tension headache is where it's a very tight band type feeling across the forehead. And that tight band can kind of feel like it's squeezing a little bit. You just don't get any relief from that tension across the forehead. And then the second or the third and fourth, I guess, so to speak, most common types of headaches are the cluster headache and a cervicogenic headache. And I know that's a big, fancy, long word. I'll get into that more in a second. But the cluster headache is typically just on one side of the face, but it's typically right behind an eye, either on the right or the left side. Migraines typically are more like throbbing. So again, they are on one side of the face, but it's a little bit more of the face than the head. And that's kind of like a throbbing sensation versus a cluster is typically an ice pick, or they call it cluster because it starts and it only lasts for about 15 to 30 minutes, but it comes in clusters or multiple times throughout the day. So if you do feel one of these headaches coming on, these quick tips are pretty much the same regardless of what type of headache that you get. It just depends on how long the headache lasts as far as how quick of a relief that you get. The first quick tip that I like to do right away is find a really cool and dark room. Whether that's in a bedroom, whether that's in a living room, make sure there's a fan going. That coolness allows your nervous system to kind of regulate, to calm down a little bit, which is really important. And the coolness also allows the muscles to relax as well. The second thing that I like to do, so I'm in my cool dark room, is I like to roll up a hand towel. And you're going to roll it up, okay? And you're going to place it horizontally right in the middle of the neck. And then all you're going to do is you're just going to lay back on it like that. You're going to do that for about 20 minutes. Now, of course, if you have any pain or anything like that, stop. You don't necessarily have to do it that way. But the purpose of being able to do that really allows your neck muscles to relax. And so you don't have that tension in the lower part of the neck as well. Another thing that I like to do is take either a cool or a warm washcloth. I prefer cool whenever I get a headache. It just feels the best for me, but I do have some patients that actually prefer kind of the warmth sensation. So they'll place like a warm washcloth just kind of over the top of the forehead, wherever you feel the headache the most with that. Essential oils Essential oils are also really great to have on hand. Here at Mindful Wellness Space, we use either Young Living or Rocky Mountain Oil. Both of those are great companies. And I prefer to use more of a lavender and a peppermint. So the peppermint kind of numbs the sensation. And you're going to place both of these kind of on the temples right here, and then also right behind the neck. These muscles, called your suboccipital muscles, get really tight and can kind of pull on some of the structure in the spine up at the top part. So both of those rubbing right on here as well as in the back help those muscles relax, and it actually helps decrease inflammation and things like that a little bit in the area. So that's great. And then the next thing that I also would recommend is if you are established with a chiropractor or if you need to get checked to see what's going on, definitely reach out, but get adjusted for sure. That top part of the neck, especially the atlas or C1, is really important to help regulate the nervous system and kind of get you through, reset your nervous system, get you through that headache as well. And then the last couple things, I always like to find some sort of meditation. So I know Emily posted a just brief kind of mindfulness check-in the other day. That's great to just allow you to kind of stop, breathe in, and calm down the nervous system as well. Because whenever you start to get a headache, things can really start to kind of drive up anxiety because you don't know what's going on, you don't know how long it's going to last. And so those little mindfulness check-ins or even meditations on 10% Happier, apps like that, if you can play one in the background, that helps you fully relax as well. And then the last thing that is super important, I would say probably this one as well as the adjustments are probably the two most important things, is to make sure you stay hydrated. If you're drinking enough water, that allows your body to detox. That also allows you to stay hydrated so that the muscles relax and your nervous system is just way happier with that too. I also recommend not just water, but it maybe even squeeze in a little bit of lemon in the water, or liquid IV. Liquid IV also is a great thing. I'm a huge fan of BioLite. It's not very common in some parts, but around this area they do carry that at Ingles, near where the Gatorades and things like that are. BioLites are sweetened with monk fruit, so that's the reason why I like that. There's not a whole lot of added stuff in there as well. Okay, so now to get into the root causes of everything, because I gave you some quick tips, gave you stuff to look for as far as the most common, but why do we even get headaches, right? So the number one thing that I see in the office, the most common, at least here, is, like I mentioned earlier in that testimonial, that it's actually a food sensitivity. MSG is a big one, so monosodium glutamate. A lot of people associate MSG with Chinese food, but it's actually not just Chinese food. They actually, believe it or not, put it in chapstick. They put it in anything that they can make taste better, because that's its number one job, is to kind of get you addicted to that and make it taste better. So definitely be on the lookout for that. They have also gotten really tricky as far as how they put it in food labels. So sometimes it doesn't even say monosodium glutamate. It literally just says MSG, or it has some sort of form of glutamate to make you think that it's not the MSG or monosodium glutamate. So definitely be on the lookout for that. The second most common, as much as I hate mentioning this, is chocolate. A lot of people don't associate that with being a headache trigger, but it definitely can. The other less common, but still can create kind of that inflammatory response and trigger headaches, is gluten and dairy. So here at the office, we do offer food sensitivity testing to kind of give you a roadmap on what to eliminate. It's called the elimination provocation. You eliminate it, and then you add it back, and you see what happens. A lot of times, patients will add that back, and they'll get a headache right away, and they'll know, hey, that's the cause of my headaches. To where when they get a headache, the goal is to say, oh, why is this coming on? The goal is not to say that, but it's to say, hey, where did I get MSG or chocolate or one of those food sensitivity things as well. The second, I guess most common root cause is just a lot of tension in that upper part of the neck. or C1 atlas that I've mentioned before. So if it gets rotated, if it gets stuck, it can actually affect blood flow, and inflammation can occur in that area. Most of the time that is made worse by food sensitivities and things like that as well. So that's where the chiropractic adjustments come in, is to really relieve the tension from the top part of the neck. Chronic infections. So I don't know if you know anybody suffering from Lyme or chronic Epstein-Barr or anything like that. Those can actually create such a response in the nervous system that it can also trigger headaches as well with that. And then I would say the last most common root cause that I have seen would probably be hormones. It can be male or female. It's not just isolated to female, although I do get a lot of patients that say, hey, after I had my first child, all of a sudden I started getting these headaches and I don't know why. So we do some testing through applied kinesiology here at the office to assess the hormones. A lot of times we have to dive a lot deeper. And so that's where that Dutch hormone testing comes in. We do offer that here. It assesses the cortisol, it assesses estrogen, progesterone, testosterone, all of those main hormones that we need a look at as well. So those are the big root causes, and each thing that we do to uncover the fix, so to speak, of that root cause is very individualized to each person. I wish there would be one thing that I can say, hey, do this and you never have a headache ever again, but unfortunately it's very individualized. So that's where the testing comes in to figure out what kind of treatment plan you need with that. So feel free to reach out if you have any questions at all. And again, thanks for joining. I appreciate it. And also check out the classes on September 9th and be on the lookout for the Holistic Health Series for September. I hope you all have a great day.